Hello. A lot of you know me as Jess. We work together here in the ED. I have put together a presentation and an in-service for a new discharge packet as part of my senior practicum course with ECPI University. The current discharge packet for patients in the ED that are discharging with antibiotics is a little out of date. Current discharge packet is very similar to one of the CDC's printouts for when to take antibiotics. It includes information on difference between viral and bacterial infections. However, it does not include information on reactions, certain side effects, prevention of antibiotic-resistant bacteria, completing your entire course of prescribed antibiotics, or probiotics. A lot of you may or may not know that this was an issue. However, now you may be asking, why is this so important? Well, because when I've asked many patients that have come into the ED that maybe they were there 2 or 3 days before, they came in for strep throat or an ear infection, or even women who have had a UTI. They're coming in and they're saying, hey, I was given this prescription, but I'm really not feeling any better. Well, when I assessed maybe what the reasoning for that would be, they go ahead and they tell me, oh, well, I didn't finish the antibiotics. I took 1 or 2 and I didn't feel better, so I stopped. This is due to them not having proper education. Proper education equals healthier patients. It's our job as nurses to be ensuring that we're providing proper education to all patients that we see in the ED. Anytime that you do proper discharge education, you increase the healthiness of that patient and you lower the likeliness of them revisiting. The general public needs to be educated on medications. Remember, what may seem like common knowledge to you as a medical worker is not common knowledge to the general public. Remember, we went to school for this. This is why we know these things. They didn't. What should be included in your discharge education packets? Side effects like nausea, vomiting, diarrhea, etc., and maybe how to cope with those. Signs and symptoms of reactions: rash, hives, itchiness, throat tightness, tingling of the extremities, ringing in the ears, visual changes. These are all things that they need to be aware of to look for to possibly call the MD immediately. We all know that with fluoroquinolones, the biggest thing is possible tendon rupture. We should be educating on that to help prevent that. Certain like vancomycin can cause toxicity and issues with your eyes or blindness. We have to be keeping up with this. Patients don't know these things. You also don't want to scare them. So tell them that these are the things to look out for, but don't say, oh, well, fluoroquinolones cause tendon rupture. Don't tell them that, because then they're not going to take the medication that they need to cure this infection that they have. Ensure they understand nausea is not a symptom of a reaction, it is a side effect. If nausea occurs, you can encourage them to take their antibiotics with their meals. Ensure completion of the entire treatment, even if they feel better. Probiotic education is very important. Most doctors are recommending now taking probiotics a couple days after completion of your treatment. This is due to the probiotic putting normal flora back into your body. However, the antibiotic is still working to fight bacteria. So now the antibiotic has to work double time in order to kill off the probiotic and the infection that you already currently had. So now, instead of taking it with your antibiotic, they want you to take it after to ensure that your infection is really truly gone. So I have created a new antibiotic discharge sheet. I want you all to look at the old packet and look at the new packet and tell me what you think. The goal is to have this incorporated into discharge packets moving forward. From now on, you guys may be seeing this new packet put into play, and it would have to educate on the information inside the packet. I have placed a survey in front of you on the tables. Please write your name and your credentials somewhere on the paper and fill it out. Leave them in a pile for me and I will collect them. Thank you for your time. These are my references. If you'd like to learn more,